This tablet is a multivitamin product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are important for the body and help keep you healthy. Ingest this medication by mouth, typically once a day or as instructed. Follow all the directions on the product package or as directed by your doctor. Do not exceed the recommended dosage. If you have any questions, consult your doctor or pharmacist. Take this medication consistently to maximize its benefits. To help you remember, take it at the same time every day. If you experience constipation, diarrhea, or an upset stomach, these effects are usually temporary and may go away as your body gets used to this medication. If any of these effects persist or worsen, be sure to inform your doctor or pharmacist right away. It's important to remember that if your doctor has prescribed this medication, they have determined that the benefits outweigh the risk of side effects. Many people using this medication do not experience serious side effects. Although rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. If the multivitamin you take includes iron, it's crucial to keep it away from kids. Accidental overdose of iron supplements is a main cause of fatal poisoning in children under 6. If an overdose happens, seek medical help immediately or contact a poison control center. Before you start taking this multivitamin, make sure to tell your doctor or pharmacist if you're allergic to any of the ingredients, or to soy/peanut, which might be in some brands, or if you have any other allergies. This product might contain inactive ingredients that could cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, be sure to let your doctor or pharmacist know your medical history, especially if you've had issues with alcohol, liver problems, or stomach/intestinal problems like ulcers or colitis. If the multivitamin you're taking contains folic acid, it's important to tell your doctor or pharmacist if you have a deficiency in vitamin B12, pernicious anemia, before taking it. Folic acid could affect certain lab tests for vitamin B12 deficiency without treating the anemia, which could lead to serious nerve problems. So, it's best to consult your doctor or pharmacist for more details. Before undergoing any surgery, be sure to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you're pregnant, make sure to tell your doctor before using this medication. And if you're breastfeeding, it's important to consult your doctor before continuing to breastfeed. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Also, if your multivitamin contains iron, be cautious about taking it at the same time as certain medications like antacids, bisphosphonates, levodopa, thyroid medications, or some antibiotics. You should ask your doctor or pharmacist about the timing of your doses and for help finding a dosing schedule that works with all your medications. And if your multivitamin contains folic acid, let your doctor or pharmacist know if you take certain anti-seizure drugs. Additionally, this medication could interfere with certain lab tests, so make sure to inform all your healthcare providers that you are taking it. If someone takes too much of this medication and has severe symptoms like fainting or difficulty breathing, they should call 911. Otherwise, they should call a poison control center immediately. In the US, residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Be sure to attend all your medical and lab appointments. Certain brands of this medication may also include other ingredients like docusate. If you're unsure about the ingredients in the brand you're using, it's best to consult your doctor or pharmacist. It's important to note that this product should not be used as a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods. Make sure to maintain a balanced diet and follow any dietary recommendations given to you by your doctor. If you are supposed to take this Mv-Min-Fa-Ca-Fe-Lycopen-Lutein tablet at specific times and you forget, take it as soon as you remember. But if it's almost time for your next dose, then just wait and take the next one as usual. Don't take 2 doses at once to make up for the missed one. Remember to keep this medication at room temperature, away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless you're told to do so. Make sure to properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.